Hi everyone, this is Prachi. I'm a certified childbirth educator from Kappa. And my topic of discussion today is nursing or breastfeeding. So in the next 20 minutes or so, I'll be talking about the importance of breast milk, how much and how often you should breastfeed your baby, pumping and storing breast milk, and various breastfeeding positions. So now let's talk about the importance of breast milk. As you all know, breast milk is the ideal food for babies. And it is safe, clean, and contains antibodies which help protect the baby against many common childhood illnesses. Breast milk also provides all the energy and nutrients that the infant needs for the first months of life, and then it keeps continuing to provide up to half or more of a child's nutrition needs during the second half of the year, that is up to 12 months, and up to 1/3 during the next, that is second year of the life. And breastfed children perform better on intelligent tests, are likely to be less overweight and obese, and less prone to diabetes later in their life. Women who breastfeed also have a reduced risk of breast and ovarian cancers. So now the next question arises, and which is the most common question, as to how much and how frequent you should be breastfeeding. So you see, every baby is different, and how much and how often your baby feeds will depend on your baby's specific needs. So there are few things to know about the first few days, weeks, and months of life. So basically, during the first days, that is the 15 days, your newborn belly is very tiny, and he or she won't need a lot of milk with each feeding. So for the first 48 hours, the baby's size is that of a marble, and the milk required is just 5 ml per feed. So if you're unable to feed your baby due to any medical interventions or any post-pregnancy complication, it's always a good idea to express your milk using a breast pump or with the use of hand expression, and feed the baby through dropper or spoon. Never ever use the bottle for the first 6 months of baby's life, because that creates a lot of confusion for the baby, because the drip from the bottle is very fast as compared to the drip from the breast. So it creates a lot of confusion for the baby, and the baby will eventually resort to getting the feed from the bottle. And it's always important to know that your baby will be feeding often. 1 to 3 hours is quite normal. And you will hear the suckling and the swallowing sounds when you feed your baby. And most babies who are getting the breast milk should not be fed infant formula unless prescribed by the doctor for any reason. And if you're concerned about meeting your baby's needs, talk to your lactation consultant or your baby's doctor right away to find out what's the issue. But always remember that breast milk is the best for your baby. And some newborns, you will see that they are very sleepy, or they are not interested in feeding, because in the initial days they are mostly sleepy. So it's your duty to wake them up. You can try patting, stroking, undressing, or changing diaper to wake them up to feed, because it's important for them to have frequent feedings, and it also helps calibrating your milk supply for future. And if your baby is not eating, drinking, and you're observing that pattern, then it's always important to talk to your doctor. So during the first, we discussed about the first 15 days. Now let's talk about the days after the next 1 month to 6 months. So your babies will start to feed longer, and on an average they'll take feed for about there will be a gap of 2 to 4 hours, and some babies will take the feed every 1 hour, which is called cluster feeding, and then they will have a long pause. And how often the baby feeds might change depending upon the time of the day. Some sessions are long, some sessions are short. But babies generally will take what they need with each feeding, and when they are full, they will stop. So they should seem content and drowsy after feeding when they've had enough milk. Your baby will also breastfeed for about 8 to 12 times in 24 hours. Now let's talk about 6 to 12 months. So during this time, your baby's feeding pattern will change, will slightly vary as compared to the first 6 months of life. And because you'll also be introducing them to solids eventually. So always follow your baby's cues when you notice the signs of hunger. And sometimes it is also called breastfeeding on demand, that you have to follow before 6 months as well. So, but the intake of breast milk may gradually decrease as you're introducing solids to them. But always it's important to note that your breast milk is the best source of nutrition, even when you start introducing solids to them. So now talking about the hunger signs, your child may be hungry if he or she puts hand to mouth, turns head towards breast, smacks and clench his hands. That means that your baby is hungry. And your baby may be full if the baby closes the mouth, turns his or her head away from the bottle, relaxes the hand after feeding. Now, let's talk about the storage of breast milk. So it's always important to feed your baby the freshly expressed breast milk. And if you're unable to feed the baby freshly expressed breast milk, then it's important to pump your breast milk and store it, because breast milk is always better than a formula milk. So we'll be talking about the storage patterns, for how long you can store the breast milk at room temperature. So basically at room temperature, the breast milk can go up till 4 to 6 hours. And if you're putting it in the freezer, then it is best to keep, if you're keeping it in the freezer, then it's best to keep from 3 to 6 months. And if it's in the fridge, then it's okay to keep it for 5 days. So when you're taking the breast milk out from the fridge, don't microwave it. You can run the breast milk under hot water, or you can put the hot water in the container and put your breast milk there. So breast milk is always good to be served when it is at a room temperature. Always store your breast milk in very clean condition, and you can store the breast milk in a glass container or a plastic container that is BPA free. And it's also okay to keep it in steel container. And if you're freezing it, then there are storage bags that are available in the market. You can buy them. They are not very expensive. So after every pumping session, it's not necessary to sanitize. You can just wash them with soap, and that should be okay. And if you face any difficulty with respect to expressing the milk for any reason, then it's always better to consult your doctor or lactation consultant. And another important thing to note is that if you're freezing the milk, then it's always important to label the bags or bottles with the amount and the date it was pumped, so you can keep a track and manage your stored milk. Now, there are some guidelines for using the expressed breast milk. So the stored milk tends to separate into layers, and you will often see a layer of cream on top of it. So just swirl it a little. Don't shake the bottle too hard, because then it dilutes the nutrition, okay, and the protective components in the bottle, in the milk. So just swirl it a little, don't shake it too hard, and then your baby should be ready to be fed. So you can feed the baby, as I said, never use bottle up till 6 months at least, and you can feed the baby through cup, spoon, dropper, whatever best suits you and your baby. And if you see that there is some milk left, and if you've taken it out from the fridge, it's okay to keep that milk at room temperature for up to 1 to 2 hours, and then you can put it back in the refrigerator. But I suggest that don't express a lot of milk in one container. Always use not more than 40 to 60 ml, because your baby's feeding amount will also be less, and then it will lead to mixing up the milk, okay? And don't keep the leftover milk for a very long time. It's okay to discard if you see a little milk that is there. Another important aspect is that it's important that you store the milk in the coldest part of the fridge, that is at the back or at the shelf above the vegetable compartment. Don't keep it in the fridge store where the temperature is less consistent. Just keep it at the center. That should be the best. And about the warming thing, I told you that a healthy full-term babies can drink the breast milk at room temperature, and it need not be warmed. And if you have to warm it, then don't use microwave. Okay, just run it under hot water, or put it in any container that has hot water in it, and that should be okay. Just keep it for a couple of minutes, and it should be at a room temperature at about 37 degrees or so, or 99 degrees Fahrenheit. And alternatively, you can also use a bottle warmer, but do not allow the temperature to go above 40 degrees Celsius, and because this can overheat your milk. Yeah, now let's talk about the various breastfeeding positions and the importance of proper positioning for breastfeeding. So see, proper positioning for breastfeeding is very important, and it helps your baby to eat and transfer milk from your breast to the baby's mouth, and helps the baby to swallow and to prevent or minimize any nipple soreness for you. And this is a concern that usually happens for the first time mothers, that they feel a nipple engorgement. But if there's a proper latch in a proper position, then it should not be a problem at all. So you need to follow these guidelines to achieve proper positioning for breastfeeding. First and foremost, you should be absolutely comfortable. You should be sitting in a comfortable seat with the provision of armrest. Use a lot of pillows. Use a nursing pillow or bed pillow to support your weight and your baby's weight, of course. Don't lean forward because you'll be sitting for a very long duration. And use a footstool during nursing if that's helpful, because you may be tired keeping your legs down. So use a footstool, elevate your legs, that should be okay. And always bring your baby to your breast. Don't lean your breast onto your baby. And place your baby in a relaxed and flexed position with his or her head slightly extended. So the baby should also be relaxed, as you need to be relaxed. Make sure that your baby's head and body are at your breast level. Hold the baby tummy to tummy, and if your baby is correctly aligned, then you should be able to draw an imaginary line from his ear to the shoulder to your baby's hip, and the imaginary line. Okay, and offer breast support with the C hold or the U hold, which is your thumb on the top and fingers underneath the breast. Don't put your finger on the areola. Use your fingers around the areola, and rotate your baby's nursing position to put your baby's mouth on a different part of your breast. So also you can just use alternate breasts. And using these guidelines, you can try using the cross cradle position, the cradle position, the sideline position, football hold, and the laid back position, which I'll be discussing now. Yeah, so let's talk about the cross cradle position. I have the baby here, and I'll help you explain the various positions. So in cross cradle position, you have to sit upright in a comfortable chair with the armrests, and bring your baby close to you, tummy to tummy like this, in case you're able to see. Okay, hold your baby through the crook of your arm like this. Okay, and just put the baby's mouth like this, and use the other hand to give support to your breast. Okay, and you see the baby's tummy to tummy. Okay, and the baby's mouth is here at my breast, and I'm supporting the breast with my other hand. So the other hand should actually help you with a U-shaped holding of your breast. Don't bend or lean forward. Instead, cradle your baby close to your breast like this. See? So my this arm is supporting the baby from the back till the neck, and the other arm is holding my breast. Yeah. So we discussed this cross cradle position. Now let's come to the cradle hold. Now, cradle hold is the most common position that most of the mothers use. So in this cradle hold, it is very similar to the cross cradle position basically. Okay, so I'll just explain. So you hold the baby in the same fashion, okay, but you put your arm like this, okay. So you use the same arm where you're like the same side from where you're feeding the baby, like this, and use the other arm to support your breast, like this. And as I said, use a comfortable chair, okay, with a lot of pillows, and hold your baby tummy to tummy, okay. Start with your baby's lower lip, and until your baby develops a full latch on your areola. So the baby should be facing your breast like this. All right, and you can use a lot of pillows on your lap to support your baby. Okay, now let's talk about the third position. So we discussed the cross cradle position, we discussed the cradle position. Now another one is the football hold or clutch hold. Now this position, it might be a good position if you've had a cesarean section, okay, because the baby won't be touching your operative part, okay, and it's also a convenient position for mothers who have large breasts. So hold your baby beside you and like this, and your elbow should be resting on a lot of pillows, okay. Yeah, and your baby's back will be resting on your forearm. As you can see here, my entire arm is supporting the baby's back and my palm is supporting the baby's neck. And from this hand, you can actually support your breast. So as I said, use a lot of pillows, use a comfortable chair. You should be comfortable while you're feeding your breast. I'm sitting upright because I'm presenting it to you. Otherwise, you can just relax and just be in a very comfortable position because the feeding sessions are going to be long. And the fourth breastfeeding position is the sideline position. So wherein you are just lying on the bed like this, resting on the bed, you're lying flat on the bed, your baby is on one side. And it may be a good choice when you want to take a lot of rest, and especially it's important to but after every feeding, it's important to return the baby to his or her original sleeping position. So you lie on your side, face your baby towards your breast by supporting him or her with one hand, okay, and with the other hand, you just grasp your breast and touch your nipple to your baby's lips. So once your baby latches on, use one arm to support your own head. You can use a lot of pillows to rest your head, okay, and bring the baby closer to you. So it is a very comfortable position. It helps you relax, but always it's important to know that you have to bring the baby back to his or her original position, and don't fall asleep when you're feeding the baby. Always have somebody by your side to wake you up in case you've fallen asleep, okay. So now the last position, which is my favorite position, is the laid back position. It's a very comfortable position. Again, you sit on the reclining chair, lot of support of the pillows. This is the baby is facing me, okay, yeah. So this position taps into your baby's natural reflexes, and this position, laid back position, is also sometimes called biological nurturing, and your baby is born with the ability to move towards his food source, which is your breast, of course, and you can play to this instinct by lying back and placing your baby tummy down like this on your chest. See how I'm holding the baby? So if I'm holding the baby using this hand, my other hand is free. I mean, I can just sip my drink, have some food, watch a movie, read my book, whatever, okay. So this is the laid back position, very comfortable as the name suggests. Okay, so I hope I explained to you the various positions, and you are clear about the pumping, storing, importance of breast milk, the frequency and the feeding patterns of the newborn baby. And in case if you have any questions, please feel free to put in your comments, and wish you a happy nursing. Thank you.